This is Dr. Drew Hall with Sarasota Upper Cervical Chiropractic. Today what we want to talk about is cognitive fog or cognitive problems, short-term memory issues. There's a lot of different reasons people have short-term memory issues, problems with recall. A lot of people reading a couple of pages, they can't remember what they read. Just a little background neurophysiologically. So there's two parts of the nervous system. There's the sympathetic nervous system and there's the parasympathetic nervous system. The sympathetics are what they call the fight or flight. So you're out in the forest, you're walking down the trail minding your own business, and a bear jumps out behind a rock. Immediately your heart starts beating, you start perspiring, your hands and feet will get cold as your blood pools internally, and basically your body is getting ready to flee from danger. And then there's the other part of the nervous system that's called the parasympathetic, which is the exact opposite of the sympathetic nervous system, and it's the calming down where you feel chill and relaxed and your mind is placid, and we call this the healing zone. So when you have increased sympathetics, your system's on overdrive, you're anxious, you perspire, you have cold hands and feet, and that is not the healing zone, that's the disease producing zone. And the parasympathetics, where your system is quelled and you're relaxed and you're at ease and you get good deep sleep, that's the healing zone. So basically what happens when you have an upper cervical spine injury, your head weighs 10 to 12 pounds and it sits on this 2-ounce bone right here. I personally was dropped on my head wrestling. Other people have a T-bone car accident. Another person heads a soccer ball that was 80 feet in the air, and another person slips and falls on the bathroom tile floor and hits their head on the toilet. These types of blunt traumas can cause injury at the joint level between the head and the neck, and what's housed inside of this vertebra right here at the base of the skull, which is this red area right here, is called the brain stem. And that is the seat of control for most of the function in the body. But one thing that happens when you have an upper neck misalignment, there's irritation on the cord, it increases what we call sympathetic tone. And when you have increased sympathetic tone, again, going back to the fight or flight, the body starts to bring the blood internally. You have constriction in the cardiovascular system. You get decreased brain blood flow to the brain, and when you have decreased blood perfusion in the brain, this causes a lack of cognition. So a lot of these people who have cognitive issues, they've had concussions, they've had bad whiplash injuries, they've had some sort of injury that's damaged the upper neck, and it's increasing the sympathetic tone in the body. So a lot of these people change their diet. They take ginkgo, which is a herb that increases blood perfusion. Some of them land in our office, Sarasota Upper Cervical Chiropractic office. We run patients through a battery of tests to find out if they have an upper neck problem, and if they do, we take a 3D image to find exactly what direction, how many millimeters, the angulation of the joint, to come up with a pattern of how someone's out of position. Everybody's pattern is different, and as a consequence, it requires a different line of correction to get the job done. But the goal of Blair Upper Cervical Care is to correct a spinal misalignment back into its normal range of motion, then monitor that patient over time to make sure that the correction is maintaining. And over that time, the body will go through this episodic healing and repair cycle. The joint that was misaligned, that had torn tissue, as it gets back in motion, the soft tissue will heal up, the joint will have better integrity, and as a consequence, the nervous system starts to fire more normally, and the parasympathetic nervous system comes back into balance. The sympathetic nervous system starts to calm down, and not only should cognitive function improve, overall body health improves, which includes your emotional state, your sleep pattern, your energy level, pain levels, muscle spasm and tightness starts to relax through the system. And the goal, really, whether they come in with cognitive problems or MS or migraine headaches or vertigo or Meniere's disease, is to correct the underlying irritation to the cord to allow the system to work better. And when the system works better, it gives the body its chance to heal and repair back to how you should function, and that's health. So if you're in the Sarasota, West Coast, Florida area, Bradenton, Venice, Osprey, Tampa Bay area, where you're within striking distance of our office, we do offer a free consultation exam. You can come in, we'll run you through a history, run you through all of our neurological findings, and determine whether we can help you or not. If you're outside the Florida area, just Google upper cervical chiropractor with the city you live in and someone hopefully is close to you, so you can get the help that you deserve, so you can function better and live life to its fullest. So hope this video got into the minds of some people who are suffering from these types of issues, and you've been on kind of a hamster wheel through the medical system and or the alternative health system and just haven't quite find a solution. Upper neck problems have huge influence on health and cognitive function, so get in and get it checked out. All right, thanks for listening. Till next time.